Hello, everybody. We did our project on malaria. So the causative agent of malaria is Plasmodium, which is a genus of parasitic protozoans of the sporozoan subclass Coppidia. The genus Plasmodium consists of all single-celled eukaryotes that are obligate parasites of vertebrates and insects, and therefore are referred to as digenetic parasites. Plasmodium infects red blood cells in mammals, including humans, birds, and reptiles, obtaining nourishment and damaging cells. There are approximately 156 named species of Plasmodium, which infect various species of vertebrates. 4 species are considered true parasites of humans, as they utilize humans almost exclusively as a natural intermediate host. These 4 include Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, and Plasmodium malariae. Plasmodium falciparum is a type of malaria that is most likely to result in severe infections. If not properly treated, it may lead to death. Although malaria can be a deadly disease, illness and death from malaria can usually be prevented.
The transmission of malaria occurs through a vector. That vector is a female Anopheles mosquito. Those are the only types of mosquitoes that can carry malaria. So that it does not spread from person to person contact, it spreads through the vector. So a mosquito can bite an infected person, then it drinks its blood, and it will get those parasites that causes malaria into the mosquito, and then the mosquito will go and then bite another person who's not infected yet, and it can release those parasites into that person's bloodstream, causing them to contract malaria. These parasites then travel to the liver, where the liver will then go affect the liver, and the liver will go and spread it throughout the bloodstream. Later on, we'll talk about a malaria attack and the signs and symptoms, but those occur when an infected red blood cell bursts. So there are high risk areas that malaria is common, and those are in subtropical and tropical climates because that is where the female mosquitoes live. And these are areas with warm temperatures, humidity, and frequent rainfall. Many of these higher countries are in South America, Central Africa, and Southeast Asia.
So we're going to talk about the characteristics of malaria. So the symptoms include a fever, vomiting, headache, general feeling of discomfort, diarrhea, abdominal pain, muscle or joint pain, rapid breathing, as well as a rapid heart rate. Now, Matt mentioned earlier, malaria attacks are whenever those red blood cells burst. Some people who have malaria can experience cycles of malaria attacks, and these attacks usually start with shivering and chills, followed by high fever, and then sweating, which is when the high fever breaks, and then eventually you return to a normal temperature. Malaria signs and symptoms typically begin within a few weeks after being bitten by an infected mosquito. However, some types of malaria parasites can lie dormant in your body for up to a year. It's important to talk to your doctor if you experience a fever while living in or after traveling to high risk malaria region, because it could be signs of an infection or a malaria attack. And then if you have severe symptoms, it's important to act on those quickly and seek medical attention in an emergency matter.
Next, we'll talk about how to diagnose malaria. So it starts with clinical symptoms. So like Morgan said, if you've traveled to a high-risk area and then you start developing those symptoms, the doctor can order a microscopic blood test. This is the main way to test if malaria is present in your body. So they'll take a sample of your blood and create a blood smear. And then with gems of stain, they'll stain that blood smear, and this will highlight any parasites located in the red blood cells. As you can see in the picture at the bottom right corner, you can see the stained parasites in the red blood cells. There's also an antigen detection test, which is in dipstick or cassette form. This has rapid results within 2 to 15 minutes, but the CDC is currently still doing studies on comparative tests if that compares to the microscopic blood test or not. There's also an antibody test. This test does not actually determine if you currently have malaria, but if you've had malaria in the past and have developed antibodies.
So I will discuss the treatment of malaria. And malaria is a very serious disease, and it can be fatal if it's not treated within the first 24 hours. And the treatment for this disease depends on several factors, such as the patient's current status, the species of the parasite, the area that the infection was acquired in, the status of resistance, whether the patient is pregnant or not, and any significant medication history of the patient. The most common type of malaria is Plasmodium falciparum, which is commonly treated with artemether-lumefantrine, coartem. And there are also chloroquine-sensitive strands, which are commonly treated with chloroquine phosphate arlin. Some major downsides to this treatment are that certain populations cannot take this drug, such as women who are pregnant or breastfeeding a child that is less than 5 kilograms, and people with severe renal impairment. This medication also tends to cost more, and the doses must be taken at certain times, which may be too much for some people. There are also side effects that go along with this drug, such as headache, dizziness, loss of appetite, weakness, fever, chills, tiredness, muscle joint pain, nausea, vomiting, abdominal pain, cough, and insomnia. And researchers are coming up with new drugs and vaccines for treatment and prevention, and also new diagnostic tests, innovative insecticide-treated materials, and those methods include rapid malaria diagnostic tests, evolving use of insecticides, durable wall liners, and long-lasting insecticide-treated nets. So something unique about malaria is that the Center for Disease Control and Prevention is actually in existence today because of malaria. It began in 1946 as the Communicable Disease Center, and its primary purpose was for controlling and eliminating malaria in the United States. Thank you.